My story is the details are very different, but the universals are there. It took me until I was 23 to become accurately diagnosed, and I have been sick since literally the moment of my birth, in and out of hospital, surgery after surgery. So I always, as a child, I had, very good physicians who were good at reacting to the infections and planning the surgeries, but no one was really connecting the dots. When I was in college is really when I began to have the experiences that so many patients can sort of nod their heads along with, where I was getting worse and no one could tell me what was wrong, so it became my problem. I was too stressed. I was too anxious. Well, anxiety doesn't cause you to be literally suffocating in mucus and in the intensive care unit with an oxygen saturation of 86. But that's what was told. I wasn't taking my medicines correctly. That must be the problem. So, I have a very rare disorder. So in that respect, yes, the details are a little different. Rare disorders are notoriously difficult to diagnose. But I think it is such a universal patient experience. When doctors can't tell you what's wrong, too often it becomes emotional. It's in your head. It's your stress. It's your anxiety. You can't deal with life. And that's why you have these symptoms. I was never really in sort of conversation with anyone from the mental health field. I felt very isolated. I was I was getting sicker and sicker and in and out of the hospital for weeks at a time, which obviously is a very stressful event. And I kept saying, you don't understand. It's not stress and anxiety that's making me sick. It's getting sicker and falling further behind in my life because I'm here in the hospital. It's stressing me out. And then I would just go home and try to do my best and ended up right back where I started from. And I didn't really have any conversations with anyone in the mental health field, but it was very isolating. It was very frustrating. I mean, it's such a slippery slope, and I think it sets up this unrealistic expectation that as a human being that you can't respond to the physical problems going on in your body. I mean, it doesn't seem in any way unnatural for me to say if you're a patient and you've had, I think, 6 months that you need to have at least one physical symptom that's disruptive. So if you're someone who's not feeling well, regardless of what the symptom is, and it is getting worse because you haven't been addressed, you haven't been appropriately identified, or you haven't gotten effective treatment, then the worse you feel, then the more that affects all the other parts of your life. So maybe you're struggling to keep up at work, or maybe you're isolated because you're not seeing your friends because you don't feel well. And of course, you're going to end up spending more time thinking about these symptoms because you want to get to the bottom of them, because you want to get better. So, I think even just that idea that patients can be hyper-focused and so therefore they have this somatic symptom disorder, well, when everything else in your life starts to fall away because of your illness, then of course you're going to think more and more about the symptoms. And I think the next part of that is, if you show this heightened or disproportionate level of anxiety or stress about them, well, I think it's all good and well to say clinically and sort of detached, okay, if you're focusing too much and you're too anxious, then you have a mental health problem, not a physical one. And again, I say, well, it's a cycle. It's a vicious cycle because the worse you feel, and again, the more that these symptoms take away from the rest of your identity, then of course you're going to get anxious. Of course you're going to be stressed because, you're not getting to the bottom of the issue. The numbers vary a little bit, but an estimated, say, 25% of Americans live with chronic pain. An overwhelming proportion of those patients are women. Women are 9 times more likely to be diagnosed with fibromyalgia. Women are 4 times more likely to have chronic fatigue. Almost 3/4 more likely to have autoimmune disorders than men. And most of those have a significant pain component. There's a long-standing bias in the treatment of pain where women are more likely to have, even when they're reporting physical pain symptoms, they're more likely to be told that it's all in their head, that they're emotional, that their pain is psychogenic, that they're somaticizing, that they're simply anxious or depressed, and, are given antidepressants when men would maybe more likely to be given painkillers for the same physical reports. So, that problem is there. It's so pronounced. It's deeply entrenched. We're definitely making progress, but even before this new DSM-5 diagnosis, thousands of patients are already being told, your pain's in your head. You're crazy. Get a better handle on your life and you'll feel better. So now I feel like this is just opening up sort of the floodgates, if you will, for this to be, instead of being told it's just in your head, now they're told, and we have a diagnosis for you. So now you're going to be, diagnosed with this mental illness, and by the way, we're still not going to get to the bottom of your pain condition, so you're going to continue to feel worse, but we'll give you antidepressants for it maybe, and maybe that will help everything. So I think it's terrible. I am a very strong believer that the universals of living with chronic illness unite us far more than disease-specific symptoms divide us. So I don't need to live with pain, for example, to understand the frustration of being told that my physical problems are all in my head, because I've been there, even though I have a totally different, really rare, kind of oddball thing. That is worth putting out there and maybe it's because I'm someone who lives with several different diseases, and I kind of float in between all these different communities, that I'm a very strong believer, again, that we have a lot of empathy and shared experiences that are worth something. I don't need to be a fibromyalgia patient whose doctor told her she's crazy to understand the frustration of feeling very ill, and in my case, being critically ill. Being in the trauma unit and having people say, "You're sure you're not just stressed out?" Like, that is a universal frustration.